and welcome to Health Live at Seniors Today. We are on a Saturday evening and we have a doctor on as our guest once again, Dr. Darius Soonawalla. Those of you who have read the last issue of Seniors Today would have read his huge article and a really exhaustive one on osteoporosis. And Dr. Soonawalla is in the house to answer your questions on osteoporosis as well as other orthopedic issues. He is consulting with the Jaslok, Beach Candy, Parsi General, and Saifee hospitals. People, of course, know a fair bit about him. He is one of the leading orthopedic surgeons in Mumbai, in the country. He has written several scientific papers in national and international journals and made presentations in various conferences and symposia. And he is a specialist in joint replacements, and he was in fact the first in the country to do a minimally invasive total hip and knee replacement, which was recently introduced internationally. So, Dr. Soonawalla, thank you for being here with us, and welcome to Health Live at Seniors Today. And thank you again for writing that fantastic article on osteoporosis. The feedback we have received can be described in only one word: tremendous. Thank you very much, and I would request you to make a few opening remarks, and then we'll go over to questions from the audience.
Thank you, Pradyumna. Good evening, and good evening to all the viewers. It's really great to be here today. What I thought is, before we, just to start off, I'd like to give your viewers, who I understand are mainly seniors, a brief overview of the two common conditions which affect them. One is osteoporosis and one is arthritis. Now, these are two completely separate conditions. Many people don't understand the difference between the two. They are completely different. Osteoporosis is essentially a condition where the bones, partly age-related, partly due to other causes, becomes weaker, and this leads to fractures. Arthritis is not something which affects the bones actually, it's something which affects the joint, which is the junction between two bones. In arthritis, you have inflammation and damage to the joint. And this leads to pain, deformities, difficulty in mobility. So the two are completely different.
And would you say that in terms of the fact that you've been practicing for so long, do you find the number of patients complaining of issues concerning these two afflictions, has that increased, or is it the same as earlier?
No, in fact, I would say it is increasing exponentially or dramatically. And the possible reason for this is that people are living so much longer and people are leading much more active lives. So the 80-year-old of today is not like the 80-year-old of 30 years ago who was relatively sedentary and inactive. You have so many 80-year-olds today who are absolutely active. And this, both these diseases, osteoporosis and arthritis, both being diseases of the elderly, that's why the incidence is going up such a
lot. But, tell me, to be able to be fighting fit at age 70 or at age 80, when does one start, looking after oneself, looking after your knees, looking after your joints, your spine? At what is the right age to start worrying about these things?
Good question. There's nothing really like a right age. For osteoporosis, the best age to start is when you're young, in your teens, because if you are active in your teens, you have a good diet, you have a healthy lifestyle, your bones will get strong and you will have strong bones. Your bones can build up till you are roughly 30 years of age. After that, the body loses the ability for the bones to strengthen. So effectively, the earlier you start strengthening the bones, the better. Having said that, a practical thing would be for people once they cross around 60, 65, and for women once they reach menopause. That would be the time when they should start actively looking at their problems. And if you suspect a problem, start treating it. Because the earlier you treat it, the better the outcome.
So, Doctor, we have a question from Sneha Patel, who says there used to be a lot of TV commercials from Cashels for calcium supplements to increase bone strength. How effective are these calcium supplements?
You know, there is a lot of supplements and vitamins which are pharma driven, and not many of them are useful. Now, the way it works with calcium is the body requires roughly 1000 to 1500 milligrams of calcium a day.
But what are the danger signs of how do you know that you are deficient in calcium deficient?
Vitamin D is pretty straightforward. There's a simple blood test which will tell you straight away, because there's no clinical way of knowing you're deficient. The problem is you have a minor fall, you get a fracture, that's when you realize that you've got weakness in your bones. So rather than wait for the fracture to occur, the whole idea is to start treatment from before. So for vitamin D and calcium, there are blood tests. The vitamin D blood test is fairly accurate. It will tell you. The calcium blood test will not really tell you that accurately if you're calcium deficient. So for that, you need to get a clinician to review your diet, review your bone density, and based on that, you can decide your further course of treatment. You know, I see a lot of people who are doing the vitamin D every 3 months. That's absolutely unnecessary. Once a year is, I feel, more than enough for the average person. And as far as the bone density goes, if you do a bone density and your bone density is normal, the next time you should do it would be after 3 years. Again, there's no advantage in repeating it every year. Of course, if you're deficient and there's some correction or treatment involved, then to assess the treatment, you might need to do it more frequently.
Great. We have a question from Krishna Jagar, who says, my age is 35 years. I follow a healthy diet, my upper back shoulder pains. What exercise do I need to do?
Really speaking, you need to find out why that pain is there. A common cause today for neck, shoulder, upper back pain is excessive computer use. And that's probably, I would say, the commonest cause. So if that is the cause in your case, what I would suggest you do is, especially if you've got a job which involves long hours on the computer, get your computer set up so that it is absolutely ergonomic, and start doing a little bit of stretches and strengthening exercises for the back, the upper back, the neck, and the shoulder.
And do you find that cases of RSI, repetitive stress injury, have also increased? And now, of course, because of the excessive use of mobile phones,
Yes,
has that also increased? Is there?
very much so, very much so. I'm getting calls all the time. My hands are paining, my hands are clicking, my thumbs are paining, my back is paining. All this is related to uh, overuse of a laptop, overuse of an iPad, overuse of the mobile, and in some cases now back, because a lot of people are doing housework which they weren't doing earlier.
But with laptops and computers, you can look at ergonomics, but with the mobile phone, you really can't do very much.
Yeah, absolutely.
So is there some kind of a advice you would give that, well, you should not be using the cell phone for beyond a certain time?
Unfortunately, the mobile has become an extension of our arm, and it's so difficult to advise somebody to minimize the use of the mobile. So, what I would now, everyone is an individual, so there's no one advice for everyone, but the principle is, if you are having these sort of repetitive stress symptoms, in the sense you're getting pain in the arm, then you need to drastically cut back your mobile use. And for that, what you could do is start using things like earphones when you're talking, rather than holding the mobile up, and rather than typing, use dictation. Little tips like that to minimize your usage.
And are there any exercises that you can do? You can, with a thumb?
You can do, it's a mix of stretching and strengthening exercises for the hands, for each part, whichever part is affected, be it the neck, the arms, the hands. So, but ultimately, if you keep abusing your hands, whatever exercise you do, it's not going to work. You need to cut back the abuse. And so, if you are suffering, you really need to cut back. Or the other option you can do is use certain splints, which will protect the arms when you're using the computer or mobile.
We have a question from Mitesh Kotecha. Mitesh says, is knee replacement a viable solution for my mother who's 80 years old? She can still walk without help in the home, but the knee joints pain a lot of times. She uses a stick for support as advised.
So, this is a sort of situation which comes up very often. Somebody who's around 80, reasonably active, and having pain in the knees, but not crippled or severely disabled by it. At 80, the surgery itself is not an issue, because particularly if the patient is a fit 80. So the issue if somebody is really disabled by it, it's a no-brainer. You need to do the surgery. For people like her who are in between, not too disabled by it, what I would say is you need to see an overall picture with your clinician. You need to see how much the trouble is, how badly the trouble has been deteriorating, in the sense every year, is it getting worse and worse? What is her health? What is her future lifestyle likely to be? Is she reasonably sedentary? Is she very active? How much is the knee pain handicapping her in terms of preventing her from doing the things she wants to do? And taking all these factors, you then need to take a decision.
I must say that your advice on this score has been much appreciated. We have when we announced that you're going to be coming for this session, we had a reader, Aspi Ibarra, who says, my friend was 25 years old, had some trouble in the knee. He went to many doctors and all advised him to go in for a knee surgery. But when he went to Dr. Soonawalla, he said that you're too young, you don't need to go for a knee surgery. And so, doctor, on this feedback that is there, what is the right time? Is there, would you say that a person who is, say, 40 or 45, and if he or she has some pain in the knee, you should not really be worried about going in for a knee surgery?
Now, what knee surgery are you looking at? If somebody is 45 and they've been advised knee replacement, I would definitely get concerned by that. Because at 45, it's too young to do a knee replacement, unless that person is really badly crippled by the knee, in which case you don't really, like I said, then it becomes a no-brainer. You don't have a choice. But what is the right time? If there's one thing I can say, what is the right time? It would be when you feel the knees are handicapping you fairly significantly. That would be the right
time. We have a question from Neelam Sethi, who says, how effective is a knee replacement surgery if you're suffering from rheumatoid arthritis?
It is as effective as if you're suffering from any other type of arthritis. So in terms of success, a knee replacement is a very successful surgery. The critical issue is when.
We have a question from Dr. Jignesh Panthaya. who says, "Sir, would you suggest something to avoid the joint pain or body ache occurred due to sitting at a long time in office?"
Make sure your chair is good, your back is well supported. If you're using a computer, we've already spoken about that. Make sure you're using it correctly and get up every half an hour, even if it's just for 2 minutes. Stretch your legs, move around, and then sit down again. At the same time, once a day, you should try to do a bit of exercises for the core and the back to strengthen them.
People who can advise you whether the way you're sitting is right or wrong. Are there other such service providers who are there who can look at the ergonomic?
Well, any physiotherapist or any orthopedic surgeon would be able to advise you.
So, for instance, if I want to check whether I'm sitting right in my home, and now increasingly with this work from home and spending a fair amount of time at home, so can I request a physiotherapist, to come home and check the way I'm sitting and if it's right or wrong?
Absolutely, you could do that.
And she or he wouldn't think that I'm nuts to do that.
No, and at the same time, you could learn some exercises and then keep doing them. So that would be, I think it would be a good investment. If I can just briefly touch on the principles when you're using a computer. So basically the top of the screen should be at the level of the eyes. So, you're looking straight, you're not looking down, you're not looking at the side. Your keyboard should roughly be at elbow level. So you're resting your elbows on the chair armrest and your elbows are straight. So again, you're not working like this when you're using a keyboard. Your back should be well supported. And roughly the hips should be roughly around 90 degrees.
Doctor, if you can see, I've already adjusted myself a bit. Suddenly
good for you.
Doctor, we have a question from Mayank Desai. He lives in Delhi. He says, my father, age 66, was advised knee replacements by doctors of a leading hospital in Delhi. I'll not reveal the name. When I traveled to Mumbai, and doctors from another hospital said the problem can be solved by doing medication and physiotherapy. My father has knee pain while walking, and he's forcing me to follow the non-surgical option. I was forcing him to take one more consultation, but he's denying to see anyone else. What are my options? Can I consult you virtually as I'm stuck in New Delhi?
Look, if the father is 65 and he is fairly active, he is not having major problems, then there is no harm in waiting a couple of years, 2 years, 3 years, 5 years. Even at 70, if the pain gets a little worse, you can always safely do the knee replacement at 70. So if the father is not willing to do knee replacement, my advice is don't push him. It's never a good idea to force somebody to do this sort of surgery.
We have a question from Hardik Patel, who says, can hip replacement surgery be performed twice? My mother had a nasty fall in the bathroom post her surgery was done in 2017. What are the chances of success? She is 72 years old and diabetic.
So, yeah, certainly. In fact, it's quite common to perform a hip replacement twice, because the earlier implants never used to last that long. They used to fail after 20 years. With modern implants, though, we are pretty confident that the hip replacement is going to last much longer than the earlier implants. But having said that, I remember a patient of mine who I have operated. And that was the 5th surgery she did on her hip replacement. So you can do 2nd and 3rd surgeries with fairly good success.
We have a question from Alpa Jain, who says, how do young women in 30s with a premature ovarian failure avoid osteoporosis? And your opinion on hormone replacement therapy?
Uh, so, for somebody with early menopause, which is what she's talking about, when you get early menopause, because of the withdrawal of estrogen from the system, women are more likely to develop osteoporosis because estrogen is one of the hormones which protect the bones. Now, for these sort of patients, a hormone replacement therapy is an ideal solution, at least for a limited period of 3 or maybe 4 years or 5 years. Unfortunately, nowadays, because there was a risk of cancer with hormone replacement therapy, it has become very unpopular. While 20, 30 years ago, a lot of women were on it. Nowadays, fewer and fewer women are on it. So, what she needs to do is sit with her gynecologist, assess her risks as far as cancer goes, and her risk of osteoporosis. And based on that, if she is a suitable candidate, I personally think hormone replacement therapy is a good option for her.
Doctor, we have a question from an anonymous attendee who says, is it possible to take tele advice for issues concerning orthopedics, because you need to necessarily look at a physical examination, but I'm just a little worried about going to a hospital or a clinic.
So yes, today I think in this situation, all doctors are doing tele consultation, including orthopedic surgeons. So yes, it's a very viable option.
And so does one visit your website and take an appointment? Is that
Yeah, so they can either phone my clinic and set it up, or they can do a tele consultation through Breach Candy Hospital.
We have another anonymous attendee, and people don't want their names to be revealed. My mother is 60 years old. She is vitamin D deficient. She had surgery on her left knee of meniscus and tissue ligament tear repaired 10 years back. She's a high BP patient, uterus removed and fibroid surgery done. Homemaker by profession, daily walks for 30 minutes. She takes calcium tablets but complains that her leg is paining sometimes and lower back pains also sometimes. So any precautions for the same?
He says she's vitamin D deficient, so I presume she's taken vitamin D supplements to sort out that deficiency, because that's the most important thing. Now, if you've had a meniscus and a ligament injury to the knee 10 years ago and had surgery for that it's very likely now that knee is going to get worn out and be a source of pain. So for this sort of thing, when she goes for a walk, what she could do is maybe wear a kneecap. She should do some non-impact exercises for the knee. If she's overweight, she should try and reduce her weight. And at this stage, she can carry on like that.
Doctor, we have a question from Dr. Zoish Patel, who says, hello, doctor. My grandmother is 85 years old and is showing early signs of dementia and is having frequent falls since the last 3 months. She already has had bilateral femur fractures repaired surgically. Kindly advise what would be a good treatment to prevent fractures due to osteoporosis, to prevent further fractures. Do hip airbags work, and are they practical to use? Do we get them in India? Please advise.
So they are not hip airbags. Basically, are sort of like a diaper which you wear, which is very padded, and so that when you fall, it buffers your fall. Now, for old people, what happens with age is you tend to have a loss in coordination. Your muscles become weaker, your bones become weaker. And this combination of weak muscles and loss of coordination is what results in the falls. So there are lots of exercises which can help the coordination. Now, unfortunately, his mother has dementia, so I don't know if the level of dementia, I don't know if she will be able to do the exercises. But for the average elderly, these sort of balancing and coordination exercises besides muscle strengthening are extremely important to prevent exactly this situation where you keep falling repeatedly.
We have a question from an anonymous attendee who says, is it possible to reverse osteoporosis without drug therapy, perhaps through exercises, but is there anything else that you have?
Is it possible to reverse osteoporosis? The answer to that is no, it's not possible to reverse osteoporosis, even with therapy. But the whole idea of the therapy is to maintain. If you can maintain the bone strength for a period of 10 or 20 years, then the person is much better off when they are older. So the treatment is essentially aimed at preventing the bone from deteriorating.
We have a question from SS Naganan. My wife at age 67 is a non-diabetic with hypertension and asthma, diagnosed with osteoporosis of both knee joints, has been advised replacement surgery for both the knees. What is the current rate of success, and how do we ensure that she will not have post-operative complications?
Okay.
What is the top-end material used currently for the implanted joint? And the last bit is, can surgery be done now in the Breach Candy Hospital during the COVID spread?
Okay, so this is, so what she basically has is osteoarthritis, not osteoporosis of the knees. This is a very common mistake. People don't appreciate the difference. But so because of osteoarthritis, she needs bilateral knee replacement. Yes, it can be done together, and the success rate is very high. It is a very successful surgery. What can you do to prevent complications? Well, I would say choose a doctor wisely and follow his instructions. If you follow his instructions, then I think today the success rate is high and the complication rate is very low. So they won't be, I don't think they need to be concerned about complications. The incidence is very low. Currently, can it be done in the COVID situation? No, currently we are not doing routine surgeries yet. We are still limiting ourselves to emergency surgery only. It's only after things open up a bit more that routine surgeries will start. And a knee replacement falls into a routine surgery. So I wouldn't recommend they do it now.
Doctor, so if there have been no knee replacement surgeries for the last 3 months, and the waiting period for knee replacements is already many months. So if one does come to you for a knee replacement surgery, how long would one have to wait?
Now that it all depends on when we open out. God alone knows. And getting a hospital bed is also good. It already is a nightmare in these times, and even once it opens up, I'm sure it's going to become quite a problem. I think there will also be a lot of patients who, in this COVID time, who are considering a knee replacement now with maybe exercise and a better lifestyle, realize that maybe they don't need the knee replacement anymore.
Sheila Kohli, who's 73 and she's from Delhi, says, could you please expand on stem cell therapy for the knees?
So this is still a relatively experimental treatment. It is basically in osteoarthritis, what you do is inject you can inject either stem cells or PRP into the knee. These act like strong anti-inflammatories and tend to reduce the pain. Do they totally cure the arthritis in the knee? No, they don't. They just delay the arthritis.
We have a question from Krishna Jagat, who had asked a question earlier. Thanks us for answering the question. Is calcium tablet required to take after 30s because she's already taking milk twice a day and other dairy products?
No, I think if she's 30, I would not advise her to take calcium. If her diet is good, she's taking milk twice a day, no need. Get good sunlight, remain active, that's more important.
But, when I was a kid, I remember various calcium products being available and being advised that you need to have it for better bones, etc. Is that a lot of...
pharma driven.
Sorry?
That's pharma driven.
That's pharma driven. Though you don't think it's really necessary to have.
At age 30, I certainly don't think so.
And not, and of course not at age 10 in that.
Let me put it this way, I'm not taking calcium supplements.
Doctor, you are a top doc, and into you know your bones well enough, so you obviously don't need
So
to.
unless there is a specific strong indication, then that would be a different reason. But to say the whole population, once they touch 30 to take calcium, the pharma companies would love me if I said that, but that would be totally wrong.
We have a question from Subbalakshmi Pramod. My mother is 81, feels weak on her legs, and sometimes not confident of walking without a stick. Sometimes even feels giddy. Would a gentle massage of her leg help?
Yes, it would help. But again, I think she should do some gentle exercises as well. Not just massage, but that weakness she feels in the legs, if she does regular exercises, can certainly be improved.
Doctor, what is your opinion about massage? Because these days you have a host of spas. Everybody likes to go to them for de-stressing, for some relief. What kind of a massage center should one go to?
So there you have two types. You have a therapeutic massage, which is a medical massage, and then you have just a regular massage. So for your regular de-stressing, you could go to any ordinary spa and get a massage. That's perfectly all right. There's no harm in that at all. But if you have a specific condition for which you need to get treated, then you need to really maybe get deep tissue massage or something done by a physiotherapist or a chiropractor or something like that.
A question from Jaswinder Singh is, Doc, are milk and milk products good for the bones? Some theory says they're acidic and may in fact be harmful.
I personally think they are good for the bone. I'm aware of that theory, but I'm not a subscriber to that theory. Having said that, there are lots of people who nowadays have lactose intolerance or allergic reactions to milk and, dietary problems with milk. So for those people, milk is not really a suitable thing to take. And these are the people who either have to take alternative sources of calcium or take supplementation.
Doctor, thank you very much for being here. As you figured, a lot of questions on osteoporosis, and we have had a fair number of senior citizens directly or people's family members who are senior citizens have asked these questions. So, thank you very much. Any overall comments that you would like to give in terms of from the basis of what you've been asked today? People need to be careful about while going on with their day-to-day lives?
I think if there is one piece of advice I can give, it would be a healthy lifestyle is more effective than any drug.
Very, very well said. And thank you very much.
Thank you. Thank you. Thanks a lot.